Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers the history of public health and community health nursing. This is just a quick overview of the community and public health nursing history. By the end of this lesson, you should be able to discuss historical events that have influence in how they have influenced healthcare delivery in the United States. You should be able to trace the ongoing interaction between the practice of public health nursing and that of nursing. You should be able to explain the significant historical trends that have influenced the development of public health nursing, and you should be able to examine the contributions of people like uh, Florence Nightingale uh, in public health nursing and other leaders. You should be able to examine ways in which nursing has provided in the community, including historically the visiting nurse associations and the official health organization and school nursing. And you should be able to discuss the status of public health nursing in the 20th century, including the major organizations that have contributed to public health. A historical approach can be used to increase the understanding of public health and community health nursing, and it's going to help us understand our past as nurses and also understand the contemporary dilemmas that are faced and the future challenges that we're going to face about nursing and about healthcare in general. The Industrial Revolution, which is what we're going to talk about first, saw the phenomena whereby there were families and friends and neighbors that were providing care previously, and this care became inadequate because of social changes that were happening in Europe, in great advances in communication and transportation and technology. There was an increased mobility that led to migration and urbanization, which in turn led to increased need for patient care. So there was a need for people, somebody to step up and help take care of sick people. An overview of the colonial period, major public health significance for this period begins that we understand that this is a period we started collecting vital statistics and we also started improving sanitation. The threat of diseases like yellow fever led to public interest in establishing boards of health so that we could take care of the people. Also, I want you to look at the Elizabethan Poor Law in 1601 that guaranteed that medical care for poor, blind, lame, and individuals similar to Medicaid be established. Okay. Even though this was happening, there was tension between the nursing roles for caring for the sick and providing preventative care, related tension between intervening for people, for groups, and as we progressed in the profession. Okay, then came the phenomena that I want you to pay attention to with the Marine Hospital Service. Providing care to sick seamen was an early effort by the federal government to improve health, and the purpose of the Marine Hospital Service was to secure trade and cut down on the risk of diseases. I also point out in your notes the Shattuck report. It took about 19 years before it was adopted, but it is significant that the recommendations of that report created the modern, what we see today as the modern public health organization, and provided guidelines for health care. I have included in your notes significant contributions by Florence Nightingale and Lillian Wald. Remember that Florence Nightingale designed and implemented the first program of trained nursing, and that's going to be important for you to note. And Lillian Wald was is known as the creator of public health nursing in the U.S. I've included in the notes significance of knowing about her and some other significant things I want you to know. Also, I want you to note Lillian Wald in 1902 helped with the school nursing movement and helped to help children that was not missing a lot of school days to be able to stay in school. Early school nursing focused on investigating causes of absenteeism, why they were missing school, and providing medical treatment. Not providing medical treatment. They focused on seeing absences and not really about medical treatment. The National Organization of Public Health Nursing was founded in 1912. It provided essential leadership and coordination of diverse public health and community health nursing efforts that were happening at that time. The National Organization of Public Health Nursing helped to standardize public health nursing and nursing education. Another organization that's important to note is the American Public Health Association, which was formed with efforts to promote the practical application of public hygiene. The American Public Health, the public health section within that APA provided nurses with a forum to discuss their concerns and strategies, and it focused the leadership and policy development of community health nursing. Uh, Early 20th century public health nursing was very interesting. What I want to note is the Metropolitan Life Insurance Company. It established the first insurance based program in 1909 to support community health nursing services. The Metropolitan Life actually helped with an average decline to 70% in mortality between the policyholders, so that there was a 20% decline in deaths of children. So they did actually do a lot. The innovative Shepherd-Towner Act in 1921 expanded community health nursing roles for maternal and child health nursing. And we know that Mary Breckinridge established the Frontier Nursing Service in 1925 to help with the rural health care. And the Frontier Nursing Service trained nurses and public health and midwifery to provide rural and to reach inaccessible areas, which really helped with mortality rates at that time. Along comes the Great Depression in public health. The federal responsibility for healthcare was limited until in the 1930s, when the economic challenges of the Depression highlighted the need and led to the expansion of the federal assistance for healthcare. Even today, programs are designed to fit funding priorities. The areas supported by Congress determine the categories in which we focus on. The World War II to the 1970s, the challenges of the World War sometimes resulted in extension of community health nursing care and sometimes in retrenchment and decreased public health nursing services. The Bolton Act of 1943 established the Cadet Nurse Corps, and during World War II, increased enrollment in nursing schools and undergraduate and graduate levels. If you were a nursing student in that time period, you would most likely have joined the Cadet Nurse Corps. By the mid 20th century, the reduced incidence of communicable diseases and the increased prevalence of chronic illnesses, accompanied by large increases in population older than 65, led to a re-examination of the goals and organization of community health nursing services as we know them today. I have included in your notes where we are from the 1970s to today. We know that the Healthcare Reform Organization has pushed has has been pushed by the increased healthcare costs, and public health nurses have been involved in healthcare reform for several years now, emphasizing on health promotion and disease prevention appear to yield reduction in cost and injury. 1988 saw the Future of Public Health report. And then in the 1990s, federal policy changes that reduced home health care services and threatened long-term survival of visiting nursing agencies. The Healthy People movement also has played a significant role in public health. Uh, in 2009, the Quad Council, an alliance for four nursing organizations, addressed public health nursing issues, finalized its own set of public health nursing competencies that are worth looking at. And then I've talked about the significance of the Healthy People movement and of the Affordable Care Act, which brought renewed emphasis on the benefits of both public health and of both in nursing. Thank you for following along with this lesson. I hope you've enjoyed this very quick overview of the history of public health nursing. If you have any questions, please refer to my corresponding notes. They have more details than this quick overview. And I encourage you to also look at the things that I mentioned if they're new to you. Look up the organizations and utilize the resources you have to make sure that you're familiar with what I've talked about. If you have any questions, please feel free to email me. Have a lovely day.